but it's a minefield, because actually there's a lot of airway focused dentists who don't like the MSE. You know, I'm specifically referring to the general dentists who do the AGGA and the ALF and the DNA. These are almost never orthodontists, by the way. They're almost always general dentists. And I don't want to, you know, I don't want to go too far down this kind of alley of discussing this, but a lot of times these folks, they're great at diagnosing airway issues. They're great at identifying them and telling a patient, oh, you need expansion, but they don't want to use the MSE for expansion, probably because they don't know anything about it and they're not skilled enough to use it. And they end up recommending the AGGA, which, as I've documented on my channel, is essentially a dangerous kind of, almost you could say fraudulent appliance that's advertised as one thing, but in reality is something else entirely. It's advertised as something that's going to actually grow your maxilla, but the reality is that it's just pushing. It's pushing on structures, and it's causing root resorption, gum loss, alveolar bone loss. It's dangerous. So I talk to a lot of people who, they know they need expansion, but they say, really, should I do the MSE or should I do the AGGA? And it's like, to me, it's a ridiculous question, because one is a legitimate orthodontist provided bone-borne expander, and then one is just, you know, it's worse than snake oil. At least snake oil.
MSE research backed up.
Tell us about your thoughts on these so-called growth appliances like AGGA. And I'm not prying for gossip here, but yes, what would you say to a patient who was thinking, you know, Dr. Ting, I need more tongue space. I'm considering the AGGA. Tell me why I should do your MSE appliance instead.
Okay, so you bring up very, very interesting topics, and I don't want to say controversial because there's nothing controversial about it. First of all, my impression, I know that a lot of people are not going to be upset with me like saying this, is first of all, I don't do FAGGA, AGGA, DNA, or ALF appliance. So I can't really comment how efficient those appliances are. And there's no orthodontist in the world I know, at least the orthodontist I know, ever trained on FAGGA, AGGA, DNA, ALF appliances. And I don't know any school, orthodontic school, that teach you how to use FAGGA, AGGA, DNA, and ALF appliance. They might be, but I don't know about. Will be very, very, very minority. So these appliances are directly marketed and taught to general dentists. Now, these are orthodontic movement appliances. They could like to call it growth appliance, whatever appliance. But the bottom line is they involve orthodontic movement. Now, if any product out there in the market doing those kind of orthodontic movement, but skip the whole spectrum of orthodontic specialty and market directly to general dentists, then it's a red flag to me. Okay. If it's a legitimate product, for example, Invisalign, for example, MSC, they will first introduce to the orthodontics community. That means that the orthodontists, the people who are expert on moving teeth, to do those kind of stuff, okay? And then there'll be research back up in the university and the orthodontic program, not some private research, to legitimize those products, okay, those appliances. Then they will be accepted in our community, because our community is a very research-based community. Then, so when there's something out there, bypass all of us, directly market to general dentists who have a few hours training on ortho in dental school. Then it's pretty suspicious. Okay, it's a red flag to me. Okay, imagine a pharmaceutical company come out with the medicine to to cure heart disease, but they don't market to the cardiologist. They market to the dermatologist or general doctor.
Right, right.
That's how ridiculous it sounds. That's how it is. But again, I never use it, so I can't say if it's efficient or not efficient. Okay, I know people who use it are general dentists who attended those continuing education classes and acquired those. No. Why would those general dentists refuse to use MSC? The bottom line is some of them, not all of them, some general dentists are very good at doing orthodontic work. Some, I'll say a large majority of them have no well-trained knowledge on how orthodontic movement happens. So when there's something new happen, they can justify is it the right thing or is it the wrong thing. Okay, and the MSC was not marketed to general dentists. It's marketed directly to the orthodontics community. So they don't push out to general dentists. So general dentist doesn't have the knowledge of it, and they don't know how to identify if that's a good appliance or a bad appliance. So they don't want to use it. Instead, they use what they have paid thousands of dollars in tuition or tens of thousands of dollars tuition to learn about FAGGA, AGGA, DNA, and alpha appliance, because those are the stuff they taught on. The stuff they're not taught on, they're afraid to use because in general, they're lacking the knowledge of orthodontic treatment, the orthodontic movement. So their vision become limited as I can only do this because I know this is what I know. This is what I taught. The other stuff I wasn't told on, so I'm afraid to use it. Okay. Now, I know plenty of general dentists who use MSC. Okay. And they happen to be excellent orthodontists as a general dentist. Okay. I know quite a few of them. Their work is better than orthodontists I know. Okay. You have general dentists like those will use the MSC. So I guess it depends on your training. If something that you don't know, you reject. If you lack the knowledge to identify the good and bad, then you're afraid to approach the situation. So they approach what they know. Now, currently in my office, I have 4 patients being treated for aftermath of the AGGA and DNA appliance. And a lot of correction to be done. I have 4 in consultation, more in the future coming up of those appliance mishaps. Happen with the bone loss, tooth being pushed out of yellow bone, and root resorption, all those severe consequences like yourself. Okay, so all I see is those patients, the messed up patient from those appliances. And I see they don't market to us. And I see the potential effect of the teeth. When I look at those, at their tooth moving appliance, they're not, in my opinion, as an orthodontist, any orthodontist in the world would say they are growth appliance. Okay, because growth doesn't come that easy. There's limitations. If there's no suture split, likely there will no growth will happen in the mature bone. So without having experience, but only experience the best of, those appliances give me a lot of worry. Okay, yeah, give me a lot of worry. And if one day those appliances get legitimized by an ortho program, go through a through and through research, not some private research, but a proper orthodontic school research, and on all different aspects, like an MSC being researched back and forth so many times on all different aspects, then the orthodontist point of view to those appliances may be different. Yeah. Okay, one can argue that, well, because I only see the bad one, the good one didn't see it, which could be absolutely true. Okay, but there's still the red flag of only the general dentist does them, not the orthodontist do them.
Yeah.
we're the specialty of moving teeth.
Yeah, and there's also the red flag that it's being advertised as something that works in one way, but the reality is that it's working in another way. So even if there are good results somewhere sometimes, even if many or most of the results are good, it's still wrong that that appliance is being sold with a package of lies, or you know, for me to be more generous, you could say ignorance. Maybe I shouldn't say lies, but a lot of ignorance. The patients are being told that their maxilla is growing forward, but that's just not what's happening. So um, there's a lot of red flags with these treatments.
Mm-hmm.
And I've been telling people for months, actually for well over a year now, be careful, and there's better options. Um, and I've spoken with so many people now who have been harmed. And for me, it's very close to home because I was harmed. And now it's costing me, I've had permanent damage to my mouth, and it's also costing me a lot of money to fix it. And I know that other people are in the same boat as me. So I do like to take every chance I get to at least caution patients to
Mm-hmm.
be careful with, especially the FAGGA, AGGA appliance.
Another thing I want to add to it is the financial factor. Many of those patients who show up with the AGGA failure, when they show me the treatment, they also show me the fee on those appliances. Okay, the appliance of those fees are simply ridiculous. It's ridiculous.
I know. $15,000 to $20,000.
Yes, that's more than enough to go through a legitimate MSC treatment. More than enough with the surgical assist and everything included. And one of the patient fee, I show my oral surgeon. My oral surgeon jaw drops and say, "Wow, that's more than the fee of surgery and MMA surgery plus your ortho treatment."
Yeah.
That been provided to a general dentist providing AGGA and DNA treatment.
Yeah.
That's how, in our eyes, it's eye-opening, jaw-dropping. See, how could someone legitimize charging patient so much more than a legitimate way to do this kind of treatment, which is MSC, MMA, or MA surgery, combined together and cost more than that. So opinions are very, very important. Okay, don't just simply buy into that. Okay, if you even if, say, those appliances, we even assume that you're going to get an excellent equal result as MSC with the MMA, or it's just MSC treatment, you still pay a lot more. You still pay a lot more, and it's still done by a not an orthodontist, but you get your work done by not a specialist, but it's a lot higher than what you will pay to a specialist.
Yeah. Yeah. I see the
Which
cost
is
thing.
the financial point that I disagree on. Assuming you get the same result, you're still paying quite a lot more. Yeah. We're not talking about 10%, 20%. We're talking about 3 times more. Okay. Yeah. 2-3 times more.
Yeah.
That's how.
And they're not getting the same result. Of course, not only are many of them getting damaged, but there's been a lot of surveys done recently. How many AGGA patients are experiencing an improvement of nasal breathing? And the answer is almost universally, not me. No change in my nasal breathing. Once in a blue moon, you get someone comment, "Oh yeah, my nasal breathing improved significantly with AGGA." Mine didn't. So, I mean, at least with MSC, at the least, you're guaranteed an improvement in nasal breathing, essentially. So they're not getting the same results. And I'll comment a little bit on the cost thing, and this is my own opinion. You don't have to, support this. I think that the reason that these AGGA providers are charging $15,000, $20,000 for this treatment is because it could be a few things. The first is more cynical. I think that they know this is a short-lived phenomenon. I think they know that within 2 to 5 years, this is going to be gone because the internet is going to expose it. The internet is going to continue to shed light on it through open sharing of information. People like me and others, such as those in the Facebook group that's dedicated to failed AGGA cases. There's now a whole Facebook group with close to 80 members, all failed AGGA cases, who are talking about their experience. This is a bubble that's going to burst. And I think they're getting while the getting's good, so to speak. I think they're trying to rake it in and just trying to, get as much as they can while they can, because this is going to be exposed eventually. But the second reason I think they're charging so much is because I believe that this treatment is being marketed to a very specific type of patient. I believe that AGGA is being marketed to the type, it's a kind of pseudo-spiritual orthodontics, you could say. It's being advertised as like the Whole Foods version of orthodontics. It's organic, it's natural, it's biologically in sync. You're pressing a button and your body is so wise that it knows how to grow if you just press in the perfect spot. And I am someone who loves natural medicine and who loves natural living. And I am intrigued by this idea that the body has a growth button that when you press it, the mouth goes, it's a beautiful idea. And people like me are willing to pay a premium for the organic product. It's like paying double for organic anything, right? This is the organic orthodontic appliance, and you pay a premium for it. And in fact, if it were any less than $15,000, then it would be suspicious, because something so brilliant, something so magical and innovative must be expensive.